a nurse's prayer, and this is actually not just for nurses. This is for all healthcare professionals and those that are essential staff. I pray for you as well, going out and still having to encounter and interact with the public day to day during this crisis and pandemic and fearful time. A nurse's prayer. Lord, please help me to bring comfort where there is pain, courage where there is fear, hope where there is despair, acceptance when the end is near, and a gentle touch within tenderness, patience, and love. Amen.
Hey YouTube, it's your girl lasheavibez coming in with an extremely exciting video. On the line I have my cousin who is a nurse, Miss Nicole Kim Dotson, and I'll be interviewing her today. It was funny because with everything that's going on with the coronavirus, COVID-19, there's so many. We're really wanting to celebrate and show our appreciation for a lot of the essential workers, our doctors, our nurses, our people in the grocery stores, and just our day-to-day people who are getting out there with face masks and gloves and doing everything to service us on a daily basis. And I have my cousin who is so special to me. We're actually first cousins. Our mothers are sisters, but to me, she's like a sister to me. She's a couple months older than me, and I really wanted to celebrate her. And I was thinking, you know what? Who can actually, who can I reach out to, or who can do a vlog on my cousin? And then I thought about it. I was like, I have my own YouTube channel. I was like, I'll go ahead and do the interview and celebrate her, and we can also, do an interview and discuss what's going on today and get her perspective, from a nurse. So on my channel today, we're going to be speaking with my beautiful and lovely cousin, Nicole Kim Dotson. I'm going to ask her a few questions.
Thanks for having me and having this opportunity to be able to talk and share my stories, and just, hopefully I can provide comfort and healing and just, be there for our nation right now.
Right. Okay. Yeah, because she's my personal nurse. I call her every time when I have any medical questions, and she's always dead on. But my first question, Nicole, is can you share your years of experience or your education, and how did you get into nursing, or how did your education start, or what did you do, or what were your methods to get through your education for the nursing, to become a nurse? And because you've been a nurse for 20 something years now, can you speak to that?
21 years I've been a registered nurse. So,
wow.
Back in high school, I was in scholars classes and scholars for science and mathematics. And when I was in 10th grade, they had a contest with the National Institute of Health, the NIH, that I had entered and had to write an essay and the application, blah, blah, blah. And they picked 6 students from my high school to get a summer internship opportunity at Children's Hospital in the University of Pittsburgh. And I was actually selected for the summer program with the National Institute of Health. And the doctors that I was selected to do the summer internship with, unfortunately, they did not get the animals in time for me to be able to work in the lab. And what they did to make use of that time is they allowed me to shadow all the different professions within the hospital. So I was able to go to pharmacy and shadow pharmacists. I was able to go to the neonatal intensive care unit, and that was one of the best experiences I could have ever done in high school. I was able to hold the babies, and they were growers and feeders, and feed them, and just caring for just tiny, tiny babies. And during that time, I talked with the nurses in the neonatal intensive care and asked them, about their schooling and their history and their experience. And they shared that, they had went to 4-year universities and got their bachelor's degrees. And they gave some recommendations of some really good schools in the Pittsburgh and Pennsylvania area, and several of the nurses had actually graduated from Duquesne University in Pittsburgh. So I decided to look into the nursing profession and start applying, I guess the end of 11th grade year to some of the schools in Pittsburgh for nursing, and I was an early decision freshman and got accepted to Duquesne. So that's where I ended up going to nursing school and got my bachelor's of science in nursing, and graduated in 1999 with my bachelor's of science in nursing, and passed my state board exams and became a registered nurse.
That is awesome, Nicole. That is so amazing. What made you want to become a nurse? Because when I think about nursing, when we talk, what I say, I think you guys have an amazing job. I mean, that's a big roles to fill, but what made you want to become a nurse? I know, you did the, interning at the hospital, but what made you really want to become a nurse? Because you have to be a certain person. You have to have a love for it,
Yes, you do have to have a love for nursing. I think just going through school and enjoying science, because a lot of nursing in the schooling that's required, you have a lot of science classes in nursing. So I think that was one of the reasons I chose nursing, because I could continue to pursue a career in science, as well as you actually get to interact and you get to help people.
Yeah.
So you get to help people to feel better. You put a smile on their face from what you do for them.
Right.
So that was something that I always, wanted to do, was whatever I did was to work with the public and be able to help people. And when I, did my internship, that was just so rewarding for me to be able to feed those little small babies that were premature or had health ailments, and actually, be there at the hospital and watch them grow, and because of what we did as nurses and what the nurses were doing. So, yeah, I love helping people.
Okay, that takes me to my next question. With you having 21 years of experience in the healthcare industry, with this whole COVID-19 and the coronavirus, have you ever seen any pandemic in your 21 years or anything like this, being in the in the nursing field, in the healthcare field?
Never. And I can talk about, like cold and flu season, usually between the months of about November up until April. Most of your larger hospitals, including the VA hospital where I work, those are months where the hospital is usually filled to capacity, sometimes over capacity, and patients are overflowing in the emergency department. So the staff, you have to worry about staff burnout. It's just a really, really busy time. And that in itself, to prepare a hospital for flu season is pretty busy. So I know how stressful for a nurse that time is, and working elevated when, your hospital is 130%. So you're 30% filled over capacity of what actual number of beds that you have that you can actually care for patients. So I cannot imagine. That's the most I've ever been through in reference to, working in a stressful environment with a large population of patients where the hospital's full and it's a lot of sick people. But in reference to what we are dealing with now and in a pandemic, never in my 21 years of nursing have I ever had to experience anything in such magnitude.
And when you say prepare for the flu, like how do the hospitals prepare for that? You mean with the beds, or like what do they do to prepare for flu season?
Well, just like on average, when it's flu season, so you're going to have an influx of patients. The elderly patients have weaker immune systems. The flu leads to pneumonia, and we do see a larger increase of deaths during that time in flu season within our hospital, but it's the older population, and it's to be expected because they can't recover as those of us that are younger with stronger immune systems. But, in reference to staffing, nursing is ensuring, okay, we've got this many vacancies. We need to get these vacancies filled, because what happens is when your hospital is filled to capacity, you also have to think about your day-to-day nurses, and, they're already working to their highest potential. Their assignments are full. The hospital's consistently turning over patients, and they get burned out. So you want to be able to ensure that they are able to go home when they can go home, and you're not mandating and forcing them to work too many overtime hours so that they can care for themselves. So ensuring that you have that extra in nursing staff. I mean, it comes down to having extra supplies that you've ordered through whatever supply chain that you have within your facility. We prepare our patient safety managers, because when the nurses are overworked and you're rushing, and you can tend to have kind of do shortcuts and tend to have more errors. So we try to continue to educate the nurses, make sure we're providing the highest quality and safety of care we're providing to the patients. Even food, we have to ensure that our nutrition and food service is ordering enough inpatient food for all of these. That of course they're going to order enough for the average number of beds, but when you have 29 additional patients that are admitted in the emergency department waiting to go up to the inpatient units in the hospital, you don't think about that when you're on a regular day-to-day order, when you're ordering food to deliver patient trays. So, police presence, where we want our law enforcement that we have within the facility to round in throughout the hospital, ensuring that everyone's safe. All employees are safe, visitors are safe, our volunteers, as well as, ensuring the safety of the patients.
Mm-hmm. Now, I know that the pandemic has two different names. I know there's the coronavirus and then COVID-19. What's the difference?
COVID-19 is just an abbreviated version of coronavirus. I think, coronavirus sounds kind of harsh. So for abbreviation, they've abbreviated to COVID-19.
Okay, that's good to know. Any advice that you could give for people that's really worried and concerned about what's going on? I mean, from a nurse's perspective, because you're face to face, you're head on with that. Like, any advice or any comfort?
Yes, I know it's a very, very scary time for all of us, all U.S. citizens. I know our nation has never experienced a pandemic before. However, just like flu season, the biggest prevention is washing your hands. Washing your hands, believe it or not, because if you are already following guidelines in self-isolating and social distancing and staying home, then you're not coming into contact with the public and those that may be carriers or have been infected with the virus. So stay at home, and if you do go out, before you touch your face, the first thing I do as soon as I come in the door is I wash my hands. Secondly, ensuring that you're wiping all your frequently touched areas, such as your doorknobs, wiping down off all surfaces, your faucets on your sinks, your cell phone, if you use a laptop, your refrigerator, handles, and your stove, pantry, wiping down surfaces and washing your hands. and social distancing. That's what's going to keep you from not contracting the coronavirus. Also, if you know of anyone sick, stay away. Just stay away. There are some that feel that, oh, if this ain't gonna happen to me, it has no discrimination pertaining to age, color, or gender.
And you know what's so funny you say that, Nicole, because I follow the briefing every day. I try to watch it just to kind of keep up to date. There's so many misconceptions and things you hear. At first they were saying that African Americans couldn't get it. Now I just heard like African Americans are 3 times the amount of any other citizens in America that have it. So now they're doing data and research on that. And then I heard like there's a pet in New York Zoo or something with the lion or the tiger, something, animals can get it as well.
Yes, and when I did my research, I did research that it's actually can be passed through mammals. So any type of animal that is a mammal, like humans are mammals, it's passed through mammals.
Wow, that's deep. So what do you think about the whole gloves and mask thing? Because, I feel like, that's fine and weird, but I see a lot of people like the other day when I was driving, I seen a guy walking, eating pizza with gloves on, but you're eating pizza with gloves. Like how that's contamination.
So it is. Unfortunately, when you wear those gloves, they're not to be meant just to put on and you just wear the same pair of gloves all day. When you should have your hands bare. And then if you are going into a store, and let's say you want to protect yourself from touching a shopping cart while you're in the store, or, as you're entering into the store, if it's like a gas station where you do not want to touch the handles, that is appropriate just for that instance. Or like what I'm religious with, pumping gas. I put on a fresh pair of gloves when I pump gas, and then guess what? As soon as I put that gas nozzle back on the tank, I immediately peel those gloves off, throw them away, and then I sanitize my hands.
Right.
So you wearing gloves and then eating and not removing those gloves, you're not protecting. You're actually, it's
transferring.
Different than you having your bare hands and not washing your hands.
Exactly, because I be looking and I'm just like, I don't know how. Or even with the mask, once you wear that and take it off, I would get rid of it. What about the cloth ones that people are washing? I mean, would you suggest somebody? I'm just so paranoid with everything now. Everything goes in the garbage with me. But when I think about them cloth masks, how would you hand wash that? I mean, I know you wouldn't throw it in a washer with other items, other clothes like.
Because it may ruin the fabric and the fiber within it that's going to protect you. So you cannot wash those masks. It's recommended that you can wear them more than once. But if they become visibly soiled, or if you come in contact with any individual that, you noted to be symptomatic, such as somebody coughing around you or sneezing, then it's highly recommended that you throw it away. But actually, they just say that when you take the mask off, not to leave it out and set it on surfaces. If you're going to reuse your mask, you should have like a brown paper bag or some type of small bag to be able to put the mask in for reuse. But if it's visibly soiled, or if you've been out in public around individuals that have been coughing or sneezing and symptomatic, you should not use that mask again.
Yeah.
And when your mask is soiled, you're supposed to put a pair of gloves on and then remove the mask and throw the mask out. You're not to touch a soiled mask with your bare hands.
Exactly. Yeah, that makes a lot of sense. What about, I heard that they're trying to, or I don't know if you heard this, but come up with a vaccine.
Well, there have been a lot of talks on local media in reference to creating a vaccine. And I know one of the trials that they're doing is those that have survived coronavirus. They are drawing their plasma and blood products. And what they want to do is be able to give like a transfusion to those that are sick of the coronavirus and symptomatic to see if they are given the transfusion of the person with the healthy antibodies now, if that will help to heal those currently sick. Now, the vaccine, like the flu vaccine, that's still being tested in a laboratory. The last update I heard is that potentially can be available and approved, FDA approved for injection maybe after September 2020.
I want to speak to something because I seen the nurse that had, and I know we had spoke to this offline, but I saw the nurse that had quit her job, and I seen some mixed comments under her video where they were saying that she took a nurse's oath, and then some people had agreed because she was stating that she was a cancer survivor and she had children that she wouldn't be able to quarantine. She actually was here in Georgia, that she wouldn't be able to quarantine from her children. What can you tell me? I didn't even know that there was a nurse's oath. I didn't even know it got that deep. Can you speak on nurse's oath and what that means to you? Or
so, as a nurse, you do take an oath to care for the sick, but there are some exceptions to thinking realistically in reference to jeopardizing your health and then the health of your family and your livelihood and well-being as well in that nurse's situation. I mean, just her having previously had cancer, and I'm sure she's probably had chemotherapy treatments, she has a weakened immune system. So I know any employee that we currently have at our hospital that had any type of cancer treatment and chemotherapy, they are not working. They're working remotely from home or on other assignments in administrative buildings. They're not currently coming into the main hospital, and where they may come into, where it's more of a probability that they may come into contact with an infected patient, because really that's the main admissions that we are receiving right now in the hospital. So I can truly understand her side on not wanting to care for those patients and thinking of her health and being there for her children. We've had a lot of talk with our hospital and our employees as well. I mean, in reference to working day to day in the hospital, taking care of COVID-19 positive patients, and then going home and potentially infecting their children and their families at home. What we recommend, if you are in direct patient care, is, you take those scrubs off while you at the hospital that you wore during the time you were caring for those patients. You get in the shower and you change your shoes at the door. And as soon as you hit the door at home, you wash your hands. But you have to immediately shower. Take your, those that are in direct patient care and caring for positive COVID-19 patients, we have the capability for our employees to be able to shower at the hospital and change back into civilian clothing and leave those soiled scrubs and uniforms at the hospital. And also, if you don't shower at your hospital, the first thing you should do, take your shoes off before entering your home at the door, and then immediately toss your scrubs in soiled laundry if you don't wash them right away, and immediately take a shower when you get home. First thing you should do. And then I just wanted to quickly speak upon in reference to also her children. Now, we do have some nurses and doctors that have the option, to stay in the local hotel if they are afraid that they do not want to carry the virus home and potentially infect their families. So I can understand her thought process in saying that she does not want to put her children and her family in harm's way, and she is the primary caregiver. She can't do that and stay in a hotel either. So her hands were tied in reference to ultimately making the best decision she had to make for the safety and what was best for her health and for her family.
Is there anything else that you would like to add, that you would like to share with people that come across this video? As far as the virus, COVID virus, any suggestions, anything? Because you gave some pretty good info. You gave some awesome information, things that I didn't even know. Anything else off the top of your head?
What I would like to say is the new statistics are coming out from Wuhan, China. And, that's where the virus first began to spread. It has been promising news. The statistics have been unbelievable. There were 42,000 healthcare employees that were flown into Wuhan, China to assist with the pandemic. And with them washing their hands, good hand hygiene, and wearing just a surgical mask, out of 42,000 employees caring for nothing but infected COVID-19 patients, not one employee had a positive test.
Wow, and that was 42,000 healthcare people from America.
42,000.
Right.
I'm not exactly sure.
Okay, but they were flown in. Now, I hear a lot of different misconceptions with the mask. Does that matter? Like, somebody had posted like a chart, like giving statistics on how likely the mask was really protecting your face. Like, I think it was the N95 was like the top one. And then just the little regular ones or the little cloth masks, like they're really not helping. I mean, what are your thoughts, or what do you know about the different type of mask?
So the N95 masks are worn in the hospital, and those are primarily for caring for patients that have droplets, like, they're coughing and they're sneezing and you're in the room and you're providing direct patient care. Outside of that, those cloth surgical masks are effective.
Okay.
And what the surgical mask does, why they're saying wear them in public, is because let's say there is an infected person out in public. The surgical mask is going to help to hold in any secretions, minimize the droplets from that infected person from spreading it to others. So you're protecting yourself from others.
Exactly. Okay.
It's not that, and then I think I may have said that backwards. You are protecting others from you.
Right.
When you wear the mask. It's not so much that, I'm going to put this mask on because I don't want other people around me breathing on me. No. If you're a carrier, you're holding back your germs from other people being able to come in contact with your germs.
Wow, that's great information. I guess we're going to go ahead and close out. I just want to say, Nicole, we really, 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 really genuinely appreciate all your hard work, all your dedication, all of your knowledge, being on the front lines every day, going in there with, a positive attitude, keeping your head up. I mean, because even if I got to go to the store 10 minutes, I'm just like, my nerves is bad. I'm rushing. I'm looking at people as you coughing, like I'm on edge. So to have to day in and day out be around people and deal with all different types of people, I want to commend you. I applaud you. That's why I really wanted to celebrate you. I'm like, who can feature my cousin? Then I'm like, I feature myself, so it's just a blessing that I was able to, just share some of the knowledge, because I get to talk to you. I'm so blessed to have you. I get to talk to you anytime, call you with questions, etc. We've discussed a few of these things, but I'm so glad you went a little deeper for me, for my understanding, for anybody that comes across this video, because a lot of people are just scared, a lot of mixed information, a lot of different information online, so to have you on and just speak to it day to day. You've been in the game 21 years. Well knowledgeable, it's just a blessing to have you. So with that, I'll go ahead and allow you to do your thing, your ending.
Okay, and how I would like to end, I just want to state I know a lot of healthcare professionals have a lot of fear and anxiety right now. We are all taken out of our comfort zone in our day-to-day work, including me. I am Deputy Chief over Quality Safety Value Service at the Durham VA Medical Center, and actually all of my staff are in administrative positions, but I've actually, including myself, have had to go through training, and all of my nurses as well, to actually be able to provide direct patient care and care for patients at the bedside. It's all hands-on. At the end of the day, everybody, we need to be there for those that are sick. I mean, they didn't ask to be sick. This is something we've never dealt with in history, a pandemic to this magnitude. But know this, we do our job, and God's going to do his job. We need to ensure that we pray and put God first, and he will protect us and help us and give us the strength through being able to care for the sick. So I know, it's fearful right now, but remember to pray and put God first.
If you come across this video, please make sure you like, share. Please share and get the word out, and subscribe. As always, thanks so much for watching and also for listening. And I'll see you in my next video.